Greetings from Bangalore. I'm Dr. Prashant Joshi. I'm a consultant fertility specialist at Cloud9 Fertility Center, Jayanagar, Bangalore. This fertility center is situated in the heart of Bangalore, and as you all know, it's a beautiful climate now in Bangalore. And good evening to all of you. Today I'll be talking on a very important subject, so that all of you can ask your any doubts regarding fertility. So I bring with me vast experience of very difficult cases of different kinds, and my special interest is also in male fertility related problems. And I take good care of patients who have azoospermic and use their own sperms, and even people with poor ovarian reserve use their own eggs. Those with advanced maternal ages, we have a special protocol for developing good eggs in all these patients, and we get very good results using advanced fertility procedures. As such, the common question which comes to everyone's mind is, when should I get myself evaluated for infertility? So this is like the first step. Like 1 year, if you're married, you're trying, you're staying together, in spite of not using contraception, there is a problem in conceiving, then definitely you need to see a doctor. So you need to see a doctor, and he will take a detailed history of both you couples and then order certain tests. What are the problems which can be there? It could be in the male, something in the sperm, the count, the motility, the morphology. These are the three main things, apart from volume, sometimes seeing pus cells. These are all minor issues. But the major issues are count, motility, and morphology in the male. In the female, it is the egg. Any problem with the ovulation? Is it getting released on time? Is she having anovulatory cycles? Is there a problem of thyroid, prolactin? Is there PCOS? Is there endometriosis, which is preventing proper ovulation? It needs to be assessed. The next thing is the tube. Any blockage in the tube? Any adhesion? There is thinking of the tube in endometriosis. So is there any problem with the tube? And the last important factor is the uterus and the endometrium. Are there any fibroids? Are there any adenomyosis? Is the endometrium too thin? Are there adhesions? Are there polyps? These simple things can be determined by doing some 2 to 3 simple tests, be it an AMH test, be it an HSG for the tubes, and a transvaginal ultrasound to document ovulation, as well as to see any structural defects and to correct them if they are there. With this brief introduction, I think we can move on if any questions have come.
Yes, Dr. Prashant. Today we have got around 17 to 80 questions. So let's go ahead with the first. Yeah. So first question is regarding fibroids. I think it's related to fibroid and for infertility.
Any specific question they want to know about fibroid?
No. In general regarding fibroid and fertility. Okay. How does it affect? Yeah.
So as I was telling you earlier also, structural anomalies or some problem in the uterus can impact the implantation process. So first we try to find out, is there any other cause of infertility? If no cause is there and only a fibroid is found, then probably this fibroid is a cause. Okay, then we have to see whether it is big enough. Is it indenting the endometrial cavity? Does it need to be really removed? If it needs to be removed, generally it is more than 4 centimeters and it is indenting the endometrial cavity. That is the time we remove. We do a laparoscopic myomectomy and remove the fibroid. And after the fibroid, three months later, we give time for the fibroid to be healed, the scar to be healed. And after that, we can do our fertility procedures. This is how it is in general. But we also have to see the location, the size, the number of fibroids. Is it a single fibroid, multiple fibroids? But just seeing a fibroid, sometimes they are seedling fibroids, there's nothing to worry. But yeah, if you wait on, these seedling fibroids can grow and become bigger with passage of time. So once there is a fibroid, don't neglect the fibroid, but keep a watch on this fibroid. How fast is it growing? Is it near to the endometrial cavity? Is it going to impair the implantation? It can also cause fibroids, can also cause sometimes miscarriages because of poor blood supply to the embryo if it gets implanted. And also they can have preterm labor. So fibroid can affect fertility, but it is not the only cause you have to evaluate for other causes also which can be coexistent.
Yes, yes, exactly. The next query is how to choose fertility treatments to get pregnant.
Yeah, first is you have to do the fertility test. Then the treatment depends on the cause. Sometimes it can be simple causes like anovulation, as I told you, PCOS, easily treatable. Just lifestyle changes can help in achieving ovulation as well as pregnancy. If there are certain other causes like thyroid, hypothyroid, then you just give them enteroxin tablets. If there is prolactin, just giving cabergoline tablets. So this reason for anovulation can be treated. If it is a tubal problem, then we have to do a tubal reversal microsurgery or choose IVF. So the advantages, disadvantages, you can discuss with your IVF specialist and go ahead. But most of the time, fertility doctors feel IVF is much better option because doing a surgery and then not sure whether you get the results, the chance of an ectopic occurring is more. Then coming to the endometrium, if there are adhesions, then we have to do hysteroscopy, remove the adhesion. If there is a fibroid, you might have to remove the fibroid, as I already told you. Similarly, in the male, if the sperm count is not good, we give lifestyle changes. The first option, give some antioxidant therapy for 1 or 2 months. If there's a hormone deficiency, we replenish the hormones. But one thing you should know, if there's low testosterone, never take testosterone. A testosterone supplement, external testosterone supplement can impair the sperm production. But endogenously, if we are able to produce it by giving some hormones, then it can definitely help sperm production. Also, lifestyle changes. And then if there is severe male infertility like azoospermia, then surgical retrieval of sperms might be required whenever there is obstructive or a non-obstructive azoospermia from the testes, get the sperm, and then in these cases, we might have to do IVF. So IVF is not the last option. It is definitely the first option in some cases, and it is the option with highest success rate compared to all other fertility treatments. But IVF is not required always. The initial step is just medications, lifestyle changes. The second is going on for milder ovulation induction. The third step is going on for IUI, and last step is going for IVF. But this is not a rule. Somebody might require IVF at once, and somebody might not require IVF at all. So there might be a stepwise, or it might be individualized. So a personalized fertility treatment needs to be planned for every case, and that is why you need to go and meet your fertility specialist.
Yes, exactly, doctor. The next query is, are there any side effects of fertility treatments?
What drugs we use in fertility nowadays are all time tested. We use most of the time the recombinant hormones, recombinant FSH. Even the urinary ones are highly purified. So side effects are all minor, like bloating, some breast tenderness. Sometimes some people might feel some mood swings, but they are all manageable and they are all very safe drugs, no long-term side effects. We were worried about OHSS, but now we are in, that is an ovarian hyperstimulation syndrome, but we have a freeze-all policy and we are a OHSS-free clinic. So we don't have this problem of OHSS, which was faced earlier days when the agonist treatment was used. Now we are all shifted to antagonist cycles, and this OHSS has come down. The other side effect, I always just joke with my patients, is getting pregnancy. And it is often a desired effect rather than a side effect. But yeah, it can be double khushi. Most people do like twins in India, and people who have not conceived for such a long time and they are getting a twin, they are overjoyed. But twins can have certain complications like preterm labor, we all know. And we as obstetricians always aim for a singleton pregnancy. But yeah, twins can, if you consider it as a side effect, it is a side effect which can occur, but it is under our control and it depends on how many embryos we transfer.
Yes, absolutely, sir. The next query is IVF and ART procedures are same?
Yeah, assisted reproductive techniques include anything to do with ovulation induction, anything to do with IUI, as well as IVF and HC. These are all ART. So ART under its umbrella has IVF also. So any kind of, but it is a advanced reproductive technique, and these are all based on the need for for the patient. Yeah. I hope I've answered.
Yes, sir. The next query is, does the fertility clinic offer embryo preservation?
Yes, yes. We do offer embryo preservation. See, the embryo freezing technique has improved over the years. It is rapid freezing in liquid nitrogen. It is not like just freezing in a fridge or some refrigerator. It is rapid freezing in liquid nitrogen. The temperature is brought down suddenly. The embryos are safe. They are freeze at that stage of their life, and they can be kept for at least 10 years. In India, the government allows us by the ART Act to freeze up to 10 years, but they have even frozen for a longer time. I came across the other day in the paper where 32-year-old embryo was transferred and they achieved pregnancy in the UK. But that's not allowed in India as per the rules. For 10 years, we can easily freeze.
Yes, sir.
And
The next
definitely offers this technology. In all our
yes, sir.
centers, all our fertility centers, we are well equipped. We offer the advanced and the latest fertility technique, and embryo freezing is done in all our centers. Do visit us, and you can avail this facility. And it is
Yes,
very important, embryo freezing, especially if you have a first time more embryos after IVF, and you want you achieve a pregnancy in this transfer, and later on you want another pregnancy 3-4 years later, and you find that your eggs are less in count, the husband sperm parameters have all decreased, but then you have a savior, you have those frozen embryos which you can transfer and achieve pregnancy. So it's a wonderful technology, and you should avail it.
Yes, sir, definitely. The next query is, I have heard there are chances of having twins with IVF. How do I know if I'm going to have twins?
Yeah. This question I've answered in part in the previous question as well. And twins, you've heard right. Twins can be there in IVF. It all depends on how many embryos we transfer. But it is under our control. If a lady is young, she's 25 to 30, and we feel that the incidence of aneuploidies, that is genetically being normal, is high in younger women, and these might just require a single embryo for transfer. But after the age of 30, especially 35, the incidence of genetic abnormalities, that is aneuploidies in the embryo, go higher. So sometimes to optimize the results, what we do is we transfer 2 embryos. But we should not transfer more than 2 embryos. Twins is acceptable, but triplets, quadruplets, quintuplets, and then having to reduce them, doing a embryo reduction is not good practice. And maximum we can transfer 2 embryos of day 5 if we have not done pre-implantation genetic screening, just to keep a backup that if it is an aneuploid, one of the embryos, then at least 1 embryo and you get the pregnancy. We want to have a higher success of pregnancy. And in some patients, they come telling, sir, I want twins. I have struggled so much. My colleague, my friend, she had got married with me. She has 2 kids. One is in already 6th standard and one is in 4th standard. I want to catch up with her. Want to finish 2 at once. So there is a request also, but as obstetricians, we always feel always safer to have a singleton pregnancy where the complications like preeclampsia, gestational diabetes, preterm labor, all are less, and it's much easier and simpler for us to manage a singleton pregnancy. But of course, the NICU facilities have also improved. There's better neonatal care, better obstetric care, and twins is also become safer. Though we still, as obstetricians, always prefer a singleton pregnancy.
Yes, sir, exactly. The next query is, we have been trying to conceive for 3 years now. How to start thinking about fertility treatments? I have heard it's very costly.
I always see these patients. Like ideally, as I told you, after 1 year, if you're trying to conceive and you're not conceived, then you should visit your fertility specialist. But there is an undue delay. A lot of times, people don't accept the fact, and they are trying some temple or some homeopathy, some Ayurveda. Nothing against them. All can act as an adjunct, but then that is not going to help you achieve in most of the cases. So you need to evaluate yourself. Is the sperm any problem is there in the sperm? Sometimes there's 0 sperms also. Sometimes there can be low sperm count. Sometimes there can be problem in the tube. Sometimes find out the cause. At least find out the cause. If everything is normal, still you're not conceiving, it is called unexplained infertility. That doesn't mean that you don't have a cause and that you will conceive. That is only by the available test we are not able to detect. But the nature is the best teacher. It will, if you don't have problem, then you should have conceived in 3 years. If not conceived in 3 years, that means you have to definitely take some help from the fertility specialist. And the next thing you asked is what is the cost? I tell cost of having a baby is priceless. Even if I have 5 crores, I can't buy my own baby if I am not able to reproduce. And it's a basic instinct of our life. But it is in the perspective what you see. In our tradition, getting married, having a child, these are values which traditionally are very important to us as Indians. And the cost, fortunately, has not gone up compared to inflation in other like you want to buy a real estate, you have to buy 2 crores. It was some 20 lakhs some 10 years ago. Now it's become 2 crores. But infertility treatment has not become like that. IVF cost around, which is the most advanced fertility, cost somewhere between 1 to 2.5 lakhs, depends on the place, the experience of doctor, your problem, based on so many other factors, which is not a big amount compared to the salary people are drawing these days, as well as like it is the same from 1980s. 1980s, of course, it was very unaffordable. Only few people in the world could afford it. But right now, I don't think that is the problem. And then again, fertility clinics are also trying to reduce the cost by giving various offers, giving EMI facilities. And we also try to bring down and help the cost as much as possible in every other way. So just don't think cost, and when I earn so much money, I'll go and have fertility. By that time, you might have age, you might be getting money, but then you will not have a child. So this is priceless. Something what I feel is what is necessary, you have to spend. What is unnecessary, you can delay it. Suppose I need a car, I can buy it 5 years down the line. But a baby, I have to, if I need it, I have to do it now. So set your priorities right, then you will feel it is not very expensive. Is it not? I think that is the way to go about it and think about it.
Yes, sir. Exactly. Rightly said, sir. The next query is
one more thing I want to bring to your this thing. Like, see, now a lot of corporate companies have also come up with insurance facilities. So some part at least they cover in insurance, the corporate insurance. So if you have an insurance, all the well, it is good, and reputed fertility centers are now offering this facility also.
Okay, sir. The next query is, how does my age affect fertility and chances of healthy pregnancy? Are there any lifestyle or medical issues that I have to work upon to or get evaluated to help with my fertility and healthy pregnancy?
I think there are 3 questions in this. First is age. Age definitely is the non-modifiable factor in fertility. So if somebody is 40 and somebody is 25, definitely a 25-year-old has more chances of conceiving than a 40-year-old. Because age is something which can have adverse effects in the female as well as in the male. In the female, it will reduce her egg quantity as well as quality. All women have a fixed number of eggs, and every month she is losing eggs. And these eggs, after the age of 35, decline rapidly. So even the vascular supply to the endometrium, the blood supply to the endometrium is decreased. So the chances of implantation, again, if they get conceived, also more chances of IUGR. And again, in pregnancy, they have a lot of factors. So age is one thing which is non-modifiable, you cannot compromise on age. If at all you want to become pregnant later on, then avail the facility of oocyte freezing and semen freezing, which can freeze your eggs at that age, and then you can even plan later on your fertility.
Yes, sir. The next one is, are there any lifestyle or medical issues which can be evaluated upon for the healthy pregnancy?
Of course. Lifestyle is the thing which is under your control, especially what you eat, what's your weight, try to achieve a healthy weight, avoid smoking, alcohol, drinking too much coffee, eat healthy foods, eat walnuts, eat sunflower seeds, vitamin E, have a sun bath, vitamin D, or at least take supplements, vitamin citrus fruits, vitamin C, leading a stress-free life. Very important. And stress-free is when you have a problem and you solve the problem, that is the best way to get rid of stress. You just can't sit and meditate when you have a problem. If you have a fertility problem, go and meet the fertility specialist. Try to solve the problem. There is a solution for every problem, and we are in an age where every woman, if she seeks the right treatment, can definitely achieve pregnancy. Most of them, at least 95% in this generation, are lucky that there is a technology for conception. 50 years later, if you were earlier, if you were born in this planet, this technology was not there, and there were many people I know in my relatives who don't have a child. So at least in this generation, if you try correctly, if you meet the right person, and if you choose the correct fertility option, then there is a very good chance you will have a pregnancy.
Yes, sir, exactly. The next query is, are there genetic or aging issues that hurt male fertility? Does family history matter?
Yeah. Are there age? Age I told you already. Males, females, maybe at the age after 35, the fertility starts declining. For males, around 40. After 40 years, there is a decline in all the parameters of the semen, with the sperm count, motility, or morphology. Morphology is looking how the sperm looks. Generally, sperm has a head, a cap over it, acrosome, neck, and the tailpiece. So there can be abnormalities in the morphology. The mitochondria, which gives energy to the sperm, the becomes weaker. The sperms become more lethargic. Their quality goes on reducing. The DFI, DNA fragmentation index, which is a test not done in many places, but it is a very important test. We just see the sperm analysis, semen analysis in most places, and they tell everything is fine, count is normal, motility is good, morphology, but then she's not conceiving, or there is abortion, conceived and there is abortion. This is because the DNA of the sperm was not good. And for this, you have to do a simple test called DFI. See if it is less than 16, it is very good. If it is more than 16 to 26, then give an antioxidant therapy and treat it. But if it is more than 26, these patients might require IVF, and we might require to take the testicular sperm also. So the DFI is a very important test which not many people are aware, and it is one of the commonest cause for unexplained male fertility, and especially in older men more than 40 years of age, where people who are smoking, they are more at risk for this abnormal DFI. So aging does affect. So don't think men are immune from aging, and we also age. Just like our hair becomes white, our testis also does not perform to the optimum level, and the sperm production as well as testosterone, endogenous testosterone production decline with age. The sex drive also might reduce. All these factors do affect male fertility.
Yes, sir. The next query is, due to vaginismus, never had intercourse. Besides, should I check male ability to ensure all is well with him? How that can be checked?
See, first is vaginismus is very common. I see a lot of women with vaginismus. This is, you are not allowing intercourse, that is, you are holding it tight when the man tries to penetrate. But that doesn't mean there is no problem in the male. You have to get evaluated for the male as well. Is there a problem with his erection? Is there a problem in his semen analysis? You can check for the male. Female, you will require help of your gynecologist, as well as you might need some psychiatric help to overcome this fear. Okay, you might require sometimes vaginal dilatation under anesthesia, which where we will dilate the vagina so that it's much easier, and the fear also is slightly reduced.
Yes, sir, exactly. The next query is there any treatment available for vaginismus offered by Cloud9?
Yes, as I already told you, we have a team of specialists who will take care of vaginismus. We will offer you vaginal dilatation under anesthesia. First, we will examine you. Is there any other cause why there is a painful intercourse? Sometimes even endometriosis in the pouch of Douglas there can be dyspareunia. So we'll evaluate other causes for dyspareunia. But of course, if it's diagnosed as vaginismus, if you're holding it tight and not allowing even a probe insertion, ultrasound probe, transvaginal ultrasound probe insertion, or sometimes even a finger by vaginal examination, then definitely you will need vaginal dilatation under anesthesia. And of course, psychiatric counseling will also play a important role in treating this vaginismus, and we do offer treatment for vaginismus.
Oh, yes, sir. The next query is, does fertility treatment cause severe mood swings and depression?
Fertility treatments, as I already told you, can cause minor mood swings. There are no major issues, but most of the times what I have seen is there is a lot of inbuilt stress in patients with infertility, and this is most of the times chronic. I have seen patients having anxiety disorders, panic disorders, because they are not able to conceive. They've gone from place to place. First, there is a problem in detecting their cause. Otherwise, if you don't find a cause, then it is like shooting in the dark. They don't know what is the cause for their infertility. Most of the time, some doctors say, all your tests are normal, go and try naturally. They're trying naturally, month after month, they are not getting pregnant. So the chronic stress is built in. And I've seen many patients, because of this, their life has got affected. They've got early onset of diabetes, hypertension, and of course, depression. Treatments don't cause that much depression, but yeah, there is an anxiety. What will the result come? And if the result comes negative, then again they are worried. I have spent some amount of money, and again I have not achieved my pregnancy. But you need a positive attitude. You need to be strong. You have to have the confidence. I will overcome this problem. And of course, in the modern day era, you don't have to lose hope. You have to meet the right person, right place. What happens in India is a lot of mushrooming of fertility centers and not adequately trained. And this ART law has come in a big way, and it will over time see that fertility practices are standardized, and the awareness about fertility treatments is spread well. And of course, mood swings and this thing can be there due to this reason, but much less likelier with fertility treatment, I would say.
Yes, sir, exactly. The next query, difference between PGD and PGS.
PGD and PGS. Yeah. See, PGD is pre-implantation genetic diagnosis, and PGS is pre-genetic implantation for screening of genetic disorders. So screening test basically means you don't have a disease, but you're screening in the general population. And here we are screening generally above the age of 40, where the chances of aneuploidy is more. So PGS is a screening. We take the biopsy day 5 blastocysts, the outer cells, tropoectoderm cells, and we check for any aneuploidies, like chromosome 21, 18, 13, which are the most common aneuploidies. Whereas PGD, suppose the mother or the father has a genetic disease like hemophilia, any problem is there, then we will check specifically even for that condition. We'll use probes in the biopsy and check whether there is this disease in the embryo. This is pre-implantation genetic diagnosis, which can use PGM, where there can be monogenetic disorders, or there can be structural translocation, structural defects, where there is a translocation. It is called PGSR, pre-implantation genetic structural rearrangement, which is the. So there's a minor difference, but the procedure is the same. We check for in the biopsy for the any genetic abnormalities in the fetus, in the embryo.
Yes, sir. The next query is the age factor related to female only when considering a successful IVF? What is natural IVF patient?
Yeah. So I have touched upon this point earlier also. Males, we often think, we often hear stories, 70-year-old guy, he impregnated a lady. But believe me, I come across a lot of patients, age, and there are a lot of studies also. Men age faster after the age of 40 in terms of their sperm parameters, like the count, the motility, the morphology all reduce. And I told you about one important factor, that is the DA5, DNA fragmentation index, which is a test, important test to be done, where we check for the DNA integrity of the fetus, if there is, of the sperm. If there is any abnormal DFI, which then you have to treat this, and then only you can have the best result in IVF also. And of course, we have to choose the best sperm with the best DNA and give the ICSI treatment, which is called as intracytoplasmic sperm injection, where we choose the best sperm available in that person and we fertilize the egg. So definitely age affects the male. Don't think only it affects female.
Yes, sir. The next query, which is better if I have unexplained
There was another part to his question, right? Apart from the age, what else did he ask?
What is the natural IVF patient?
Okay, natural IVF patient. See, when the first baby which was born in 1978, it was a natural cycle IVF. See, natural cycle, what happens is only we don't give any medicines. Whatever one egg is formed, we take that one egg outside without giving medicine, fertilize with the sperm, and then we achieve, we try to get the embryo. That is called as natural cycle. Of course, there's natural cycle transfer also, where we monitor how the egg is becomes big enough, 18 to 20, we see the endometrium, what is the thickness, and when the egg ruptures, we start after 5 days, which is the usual time, the embryo implants, we do the embryo transfer. That is called a natural cycle transfer. So there's a natural cycle IVF, there's a natural cycle transfer. These are methods which are different types of IVF.
Yes, sir. The next query is, what is better if I have unexplained infertility, IUI or IVF?
If you have unexplained infertility, it depends first on your age. Are you 40 years? Are you 35 years? You're 30 years. Okay. Most of the time, what we try in IUI is to get more eggs and more sperm, and which is well achieved with controlled ovarian stimulation and IUI, where we stimulate the ovaries to produce 2 or 3 eggs, and we wash sperm we take and we put it inside the uterus, where closer to the fundus, so that it can move, and at the time of ovulation, it can fertilize the egg and achieve pregnancy. The first step in most cases of unexplained infertility is IUI. If 3 cycles of IUI fail, then we can go for IVF. But the chances of pregnancy is much higher in unexplained infertility for IUI, around 10 to 15% compared to other where there is severe male factor infertility. And if you are above 40, there is no much time, then you can reduce the number of cycles of IUI, and maybe in some cases you can even directly go for IVF.
Yes, sir. The next query is it wise decision to freeze eggs and sperms?
Of course. It's a very wise decision. You have this technology, fortunately, in this generation, and you all can avail it. Especially in this generation, I have seen many people, because of their career or because of social reasons, finding the Mr. Right person. And so many in arranged marriage, so many reasons, or sometimes even love marriage, and the approval from the parents is pending, and they are at some stage where they have to delay getting married and then planning for a child. Then definitely it is worth freezing your eggs, because this gives you a good chance even when you're planning for a pregnancy later on, when the egg quality and quantity is not that good. So semen freezing also like that only, because now maybe your sperms are fine, but after you age 8 years, 10 years, you never know what will be your sperms. So definitely you can avail this technology and make use of it.
Yes, sir, exactly. The next question.
A lot of people are not aware these freezing techniques are available, and if you check their AMH and it is already less, better you freeze your eggs. This technology, not everyone is aware, and only some cancer patients, before they undergo radiotherapy, chemotherapy, their oncosurgeon tells them you freeze for your eggs, then only they come. But even social egg freezing, which is just for social reasons, freezing your eggs is a very good idea. It's a great idea.
Yes, sir. The next query is, I have endometriosis and how will it affect my fertility?
Okay. So endometriosis affect fertility in a variety of ways. What is endometriosis? It is basically an endometrium. Instead of being in the right place, that is the uterus endometrium inner lining, it gets implanted in the peritoneum, in the ovary, over the tubes, etc. So what happens every time the menstrual cycle occurs, there is bleeding inside also. Suppose there is bleeding in the peritoneum or over the tube, over the eggs. What happens is there are adhesions when they bleed. There is a inflammatory response. So there can be adhesions which can distort the anatomy. The tube can be kinked. The tube might not be able to pick up the egg properly. There might be inflammation. Because of the bleeding inside the ovary, what we say as a chocolate cyst or an endometriotic cyst, there can decrease the ovarian reserve as well as the oocyte quality. All these factors, they can get pain during that bleeding. They are not able to have proper intercourse sometimes if you have a deep infiltrating endometriosis in the pouch of Douglas. So all these factors can impact the quality of life as well as fertility chances. So endometriosis is known to cause infertility due to the reasons I already told: distortion of the anatomy because of immunological factors, because of inflammatory factors, and because of the chocolate cyst in the ovary, which can cause pressure, as well as because there is bleeding and then there are adhesions. You lose follicles and which are eggs, you lose your eggs, and the quality also reduces, and all this can impact your fertility.
Yes, sir. The next query is, I have a family history of breast, ovarian, and colon cancer on my mother's side, and that has been diagnosed after my first pregnancy. Now I want to plan a second child, and how can I prevent this mutation in my child? I have been diagnosed as having the same mutation what my mother had.
Okay. Since there is a family of this BRCA1 and BRCA2, this thing, you already have a baby. Okay, you are planning for the next baby. What you can do is we can have a genetic counseling. We have genetic team of genetic counselors with us. We can do a genetic testing on your embryos, and then we can decide whether we can go ahead with the pregnancy.
Yes, sir. So these were the questions for the today. Thank you, sir. Thank you for joining. Thank you all the viewers for joining this today's session, and thank you, Dr. Prashant, for addressing all the queries of our viewers. Thank you.
Thank you.
Yeah.